in this very important first way to see on seeing the patient. É importantíssima a primeira abordagem. Thank you.
The other thing that I think is very interesting is I'm going to have you take to the side. I do the hand grip stroke. Oh, she is good. But good manners would say that I don't feel the back of the arm. We're not doing this for good manners. What I want to do is feel the back of her arm while I'm doing this to see what the muscle tone is there. I want to know if it feels like she's lost a lot of subcutaneous tissue, if what's happening with her muscles. So she thinks I'm just being very nice and polite and giving her this. But I'm actually doing a sneaky, did everybody know sneaky? Okay, a sneaky check of what's going on with her physical tech. Now, you look like you want to ask a question.
No, we have a problem with that in Portugal. The infection protocol they are implementing in primary care is you don't touch your patient.
Okay.
And they have that in front of your office. Don't handshake. Of course, I handshake my patients, and don't hug your patients. So
in Portugal, you get
yes.
Now, is that for everybody, or only if there's infection?
That's an infection protocol they are trying to implement in all facilities.
Everything.
Yes. Some started it. My facility started, and I think it's pretty stupid because then we can't do physical exams.
Yeah, and I don't think that they're going to have the physicians not touch patients.
Exactly.
Now, there's a way you can handle that. Put gloves on. You can still shake hands with gloves. You can still touch here with gloves. You don't have to kiss them, even though that's Portuguese. But the reality is, I think that it's an important thing to still touch them. I think it's good for the patient. It doesn't keep them separated from you. Now, would you guys think that I'm probably a nice doctor to my patients? Okay? So if we're going to take you over here to the exam, this very fancy exam table that we have. Now, I would help her up to the thing, okay? Now, when I'm helping her up, if I was at the other end, because I'm right-handed, not left-handed, but I would be helping her up and I'd touch her back. Now, what am I checking from her back? I'm checking in the area of the scapula to feel if there looks like there's muscle wasting there. I also might be feeling the muscle and fat over her ribs. If I can feel that, no matter what her weight's telling me, it tells me there's chronic loss of limb tissue. Now, let's say that you had very low blood protein, your albumin was low, transferrin was low. What would your ankles look like probably? They'd be swollen, okay? Now you come into the hospital, what happens to your legs? You get put in bed, your legs are elevated, lots of times your head is elevated. So where does your fluid go? It can go there, or lots of times it's over the sacrum. And so lots of times if you touch someone back there, and I always say, is it okay if I touch? But the reality is you can have, to the point where it's so bad that you can't even push in. It feels like wood. So if somebody says, oh, their feet look so much better, and they've been sitting in a bed with their head up, always look to the sacrum to see what's going on there. The other thing is there are things that we can do functionally that tells. Very simple things. Now, lots of times dietitians don't have an exam room to be examining you. So I can have you do this in the chair. But we'll let you sit here so everybody can see. You don't get off that easily. So if I want to see where function is, I'm going to say, I want you to show me how strong you are. So I'm going to push against you. You put your hands like this, and I'm going to push towards you. You show me how good you are. Okay? She's not letting me push in. Now, which muscles is that having an impact? Okay? So if I want to have the other direction, and go this way. Okay? So we're looking at biceps, triceps. We can do it this way. I can pull out or push in, and that tells me about our lower extremity. Now, where is most of the muscle mass in the body? Up below the waist or above the waist? Good answer. My patient knows it. Come on, guys. If you think about it, you've got your quadriceps, if you think about it, I have most of my fat below my waist too, but even me, most of my muscle is below my waist. Okay, if I want to look at malnutrition-related muscle loss, do I look above the waist or do below the waist? Both. Why both? Big voice so that you can hear you.
If perfect because the waist needs all over.
But most of it's going to be down here.
Down here. Exactly.
If I want to only look at nutritional loss and not inactivity, look above the waist. Yes, because what's happening is this is going to be a combination of inactivity and malnutrition. This is going to be malnutrition. And even if I'm bedridden, for me to move myself around in the bed, I still have to use my upper extremities. You probably would think that I still have to talk with my hands. So all that, if I have to feed myself, I'm still using my upper extremities. Okay? Now, lots of times people say if you want to check muscle tone, have them tense their muscles. Do you know how to tense your muscle? Probably not very well. Why don't you put your leg out, and I'm going to try and do this. Now she knows how to tense her muscles. So telling people to tense it is not as good as actually having the muscle function, and then you can actually see how good the tone is. Now, we have somebody that we've also asked in the front row to perhaps, is this the time that we should do this area or later? Okay, Sonia. I'm going to bring, is there anything else you'd like to ask, other than giving her a round of applause, anything else you'd like to ask our patient here in terms of her physical? If you were a patient, would you feel uncomfortable with me as a dietitian or a nutritionist if I'm telling you why I'm doing this? Don't be touchy.
No.
Would any of your patients? What I think is important is how comfortable you feel in doing it, because that comes across to the patient. When I was a very early student, I think I was a first-year student, and I was doing something, and I had a patient who said, I don't want to be like your experiment. How many of these have you done? I said, enough. He said, that's all I wanted to know. Enough could have been 1, enough could have been 50. He just wanted to know that I felt comfortable, and I had no good answer to him other than, I've done enough of these. Okay, fine, let's go, we'll go do it. So I'm going to let you down again, and we're going to give her a round of applause.